We're almost at the 2-year mark of the COVID-19 pandemic, and suffice it to say, I think we're a long way from the end. Worldwide, we're at 270 million cases, and as Sandy said, 5.3 million deaths. The United States at over 50 million cases and over 800,000 deaths. In other words, we account for about 1 out of 5 cases and 1 out of 6 deaths in the whole globe, which is way higher than would be expected for our population, which is indication of how badly we're doing. More Americans have died from this pandemic in 2 years than died in all the wars of the last 120 years, including World War I and World War II. Because sometimes that number, 800,000, doesn't register. I do also want to remind you that of the 50 million who did survive COVID, they're not out of the woods, as we don't know the long-term consequences of COVID, though we do know that many do end up with persistent health issues. The next wave is here. We have over 120,000 new cases a day now, about a 40% increase over the prior 2 weeks, and about 68,000 hospitalizations, an increase of about 21%. Our healthcare system, in which I work, has been stretched to the breaking point several times already during this pandemic, and is totally poorly equipped to deal with this wave. Many healthcare providers who are my colleagues are leaving the healthcare system now, and those who are staying are burnt out and depressed. Some good news, 61% of the population is fully vaccinated. There are still some disparities in receipt by race and ethnicity. Black Americans are still the least likely to be fully vaccinated, while Latinos and whites have similar rates, and Asians have the highest rates. The gap, though, between Black and Latinos and whites have closed significantly, partly because Black and Latinos are doing better with vaccination, and whites have sort of reached a plateau in terms of the vaccination rates. The bad news is the effectiveness of the 2 doses of the Moderna or Pfizer vaccines are significantly reduced against the Omicron variant. So now we're not only have to assess the rate of full vaccination, we also assess the rate of booster receipt. Only 31% of those 18 and older and 53% of those 65 and older have had their booster shot. On the treatment side, the new Pfizer COVID medication Paxlovid, through a press release, we haven't seen the actual science yet, is about 90% effective in preventing severe disease and death in a randomized controlled trial. But it wasn't great at reducing symptoms. And again, we don't know what it would do for the long-term health effects from those who survive COVID. So it's not a panacea. My co-panelists will be talking more about Omicron, but we do know that the more cases we have, the more the virus can mutate. And the more mutations there are, the more likely that one will come that escapes the current vaccines and treatment. So that is why we have to really continually emphasize the importance of the public health approach of getting everyone vaccinated, but also making sure that people wear surgical or N95 masks around others and having easy access to rapid COVID testing. I'll finish by saying that the misinformation and disinformation around COVID prevention and treatment have been very damaging and deadly. We need to fight this rapid viral spread of COVID-19 with the rapid spread of good information that will protect our people.